Good afternoon. My name is John DiPersio. I'm from Washington University in St. Louis, and my charge is to discuss emerging immunotherapies in AML. AML is a difficult disease to target, and for that reason, we've elected to use a cellular therapy called bispecific agents. But I'm here to really talk in general about how this might work to enhance the treatment of patients with AML. On the next slide, you'll see a cartoon of a number of potential immunotherapies for AML, and these include CAR T cells, bispecific T cell engagers, and dual affinity retargeting agents. And for the studies that I would like to describe, we have chosen to develop a dual affinity retargeting agent, or DART, which is directed to an AML target called CD123, and also directed towards the CD3 receptor, which activates T cells in the context of their target cells. In the next slide, the scFv that we've used to design our DART is directed to domain 1 of the extracellular domain of CD123. And obviously, we need to make sure that that's expressed in AML cells. And you can see by the RNA-seq data on the right from over 200 AML samples that for the most part, the SP1 transcript, which contains domain 1, is expressed in the vast majority of AML samples. And there are a few AML samples that express this variant transcript in which domain 1 has been spliced out. Obviously, those samples, this DART would not be expected to be effective in. You can see that the expression of 123 is high in all AML samples and very low in normal blood samples, with the exception of these plasmacytoid dendritic cells, which are also CD34 positive. And on the bottom part of this slide, I'm just describing some of the reagents that have been now developed preclinically and clinically for the targeting of AML and the treatment of acute myelogenous leukemia. This is just a cartoon of how we actually put this bispecific agent together. And we put the 123 scFv regions together with the CD3 scFvs, making a dual affinity agent called a dual affinity retargeting agent. And if it works, what we should see is that this will physically induce the interaction of a T cell with a CD123 AML target. The second thing that will happen on the right part of this slide is that the T cells will be activated and will expand. And then finally, on the left side of this slide, the targets will be killed by the T cells. This is the design of the clinical trial that we're testing with a company called Macrogenics. And this trial is ongoing now, and we're about a third of the way through the trial. And what we've noticed is some responses, but also significant patients who develop cytokine release syndrome. This is an in vitro experiment showing that our dual affinity agent is doing what it's supposed to do. And in the left panels, you can see that it induces the aggregation in the upper right panel of T cells and target cells. And in the middle panels, you can see the real DART on the bottom. It induces the activation of CD25, meaning that T cells are activated. And on the right panels, you can see that these T cells are also replicating in the presence of the real DART. So it's doing exactly what it's supposed to be doing. What we didn't realize is that we were going to see some cytokine release syndrome, which we've seen in almost every patient. And on this slide, I'm showing you the targets that are commonly being targeted in AML. And the red ones are targets that are also expressed in granulocytes and monocytes. And we think that this is going to be a future problem with all targets in which the AML target is also expressed on monocytes and granulocytes. So that if one wants to avoid cytokine release syndrome, we need to find targets that are expressed only on hematopoietic stem cells or leukemic stem cells and not also on granulocytes and monocytes. And in the little box here, I just show you a number of the reagents that are under clinical development. So in conclusion, CD123 is a rational candidate for a shared antigen for AML targeting. The current DART this clinical trial suggests both activity and toxicity. Cytokine release syndrome is a major problem, and ideal targets in AML are those that are expressed in AML and absent in normal stem cells and monocytes and granulocytes. And also, the effect of any CAR or DART or BiTE to an AML antigen will be undermined by the presence of this antigen on normal tissue monocytes, macrophages, or granulocytes. Thank you very much.